Thank you, Cathaoirleach. Minister, I raised the issue I'm going to raise with you now in the Dáil over the last couple of weeks. It's to do with the South East Palliative Care Centre, which is part of a building, a new unit, which has been completed. It's the Dunmore wing at University Hospital, Waterford. As you know, the top 3 floors will house 72 acute beds run by hospital management and the hospital itself, and the bottom 2 floors a new state-of-the-art palliative care facility. Local Oireachtas members got a tour of that facility last week, including some of your own colleagues and Minister John Halligan as well. The problem is, as you know, that only 300,000 has been allocated as a start in relation to the staffing, the revenue funding for the facility. The palliative care will be run by the CHO. There is a lot of concern. I think people are scandalised, to be honest, in the South East, that this building is built, it's fully equipped, it's ready to be open, and yet it hasn't received the revenue funding. We're meeting with the officials and they're telling us locally that even when they get the funding and they still haven't been given any allocation, they have to recruit the staff. So we could be talking about a year or more before that unit becomes operational. So can I ask, first of all, how much will it cost to fully staff the palliative care unit? Why wasn't that funding given much earlier, knowing that this was going to be completed in the summer of this year, fully equipped, ready to be open, and yet it could be lying idle there, sitting there for months, if not a year or more, when patients in the South East deserve the same palliative care options that people in other parts of the country have? And you said in parliamentary question responses that there will be an allocation arising from the estimates and in the overall funding that will go into palliative care. So my question is, will the full year, I think it's 4.5 million, 4.6 for next year, and then 5 million for subsequent years, will the full allocation be given in the estimate?
Thank you, Deputy Cullinane.
To make sure that that unit can be fully open?
Thank you very much for your question.
Thank you.
Minister.
Because I'm having a meeting tomorrow with Deputy Cullinane and the Oireachtas members on a cross-party basis from Waterford. Very much respect the way they work on a cross-party basis on issues of importance in the South East. I think it's quite effective, actually. I'm very much aware of the concerns of the people of the South East in this regard. You have a new state-of-the-art Dunmore wing built. Within it, as you say, will be an incredible palliative care facility as well. My understanding is the South East Palliative Care Centre was constructed at a cost of 31.26 million. I want to thank the Waterford Hospice Movement, who I think have agreed to provide 6 million to the HSE towards the cost of the lower level and level 1 for palliative care. So incredible community support for this as well. This will be the first inpatient and day service specialist palliative care unit for the South East, and will really cover the South East, Carlow, Kilkenny, South Tip, Waterford and Wexford. And when fully operational, I think there will be 20 inpatient bedrooms with individual gardens for anybody who requires the expertise of specialist palliative care multidisciplinary teams. The Deputy is entirely correct that there is an allocation of 300,000 for this year for this hospice and a number of others. Deputy Donnelly, Deputy Brady and I'll be aware of our one in Wicklow. The question that the people in Waterford and the South East are asking is, we can't open it now unless we have the certainty that the 4.8 is the figure I've been given, 4.8 million will be in place for 2020. I'm very hopeful that we can resolve this matter together this week. I'd like to see the matter resolved together this week so that there can be certainty. I also understand, and I don't want to get involved in the minutiae of this because it's not my place to do so. You're quite right, there will be a time lag. You know, you authorise funding, people will have to go out and recruit the appropriate staff and be ready to provide the services. We have funding to begin that process now, 300,000 for this year. My job is to make sure we absolutely have the funding for 2020 so they can proceed with certainty, and I think we can try and resolve that together this week.
Thank you very much, Minister.